So one question men have is, I am young and fit. Is it reasonable for me to do active surveillance? So the answer to that will vary as to the physician a little bit. There are some physicians around the world that would say, no, you were young, therefore you must have treatment. The idea being that having treatment for prostate cancer is an investment in their future. Most physicians now that specialize in managing prostate cancer, even in the United States, oddly, do now feel that we have enough information about active surveillance that it is reasonable to consider it in younger men. So it is something to talk about if you are a younger man, to see if that might be a fit. And whether it is going to be a fit depends on the details of your particular case, the PSA, the Gleason score, and the clinical stage. The second thing that men need to know about active surveillance is what's involved. And so what I tend to do is take people through a bit of a history. So before such a thing as active surveillance was invented, we talked about something called watchful waiting, which is a term we still use today. And these days what watchful waiting refers to is every so often having a PSA and a digital rectal examination, so the finger check of the prostate. So imagine active surveillance being watchful waiting plus. So what's the plus? The plus is you add a biopsy every so often. So it's a biopsy done the same way as most biopsies are done initially when men are diagnosed in the first place. So it's done using an ultrasound probe that's inserted in the rectum, and the ultrasound directs where in the prostate the needle goes to take the biopsy. So that biopsy is not done frequently. Usually it's done within the first year of the initial biopsy that showed the cancer in the first place. And then maybe every 3 years or so after that, depending. Everybody has a slightly different program for that. But knowing the details of that is important, because some men go, oh, are you nuts? I'm not having repeat biopsies. And then the question you need to ask is, well, if you don't like the idea of biopsies and yet the idea of watching the cancer, I mean, is it reasonable to just do watchful waiting without the biopsy? Now, the answer to that question will depend on the case. Actually, the way that works for me is, I'm more comfortable with watchful waiting in an older man with health problems in whom I think the life expectancy is less than 10 years, and less comfortable about that if somebody's young and fit and going to live 30 years. And in fact, I've been in practice a long time. I mean, I start out with active surveillance in some men, and later as they get older, we transition to watchful waiting for various reasons, including that. So getting a little bit of a sense of kind of what these terms mean, and also kind of what's involved, and sometimes what you hear about it may make men say, well, don't want active surveillance just because of how it's done, particularly the transrectal ultrasound-guided biopsies. The other thing that men need to know is, okay, what do you do if you find out that the cancer is growing? And that's one of the components of the word active. The idea, of course, is you're going to get on with it if there's evidence that treatment needs to be done. And so then it's nice for men to be thinking about, okay, if they did need treatment at any point in the future, what might that be? Not to decide it for sure, but at least have some idea. So if in 4 or 5 years there's something that turns up on the active surveillance program that implies they should have treatment, then you have a bit of an idea of kind of what that might be in general terms. And along the way, it's nice to learn also, sort of like following along with Mitch Miller in the old days, following along what we're doing, the PSA values, people tend to kind of follow those themselves. They get copies of the PSA reports and stuff. And some men even get copies of the repeat biopsy reports. And they learn, and there's a lot of articles and stuff out there that will teach you, okay, what are we looking for? Trying to crawl inside the mind of a doctor that's following prostate cancer in an active surveillance program. And basically, to an extent, knowledge is power and knowledge is confidence. So you get a bit of a sense of, kind of what we're looking for, and you're kind of part of the team a little bit more. It's harder to be part of the team if you're not quite so familiar. Another thing that men need to know is you can, so-called, quotes, hit the chicken switch. So my colleague in Boston, Dr. Anthony Zeitman, coined that phrase. What that really means is if you start with active surveillance and you change your mind later, you can. So there's nothing about saying I want active surveillance that means you can't change your mind and have surgery later.